Alright guys, let's talk about the 3 types of intravenous fluids. Please enjoy this beautiful picture that I took as we drove through Napa. So let's start off with isotonic fluids. So isotonic fluids treat vascular system deficits. The way that I remember it is saying isotonic stays where I put it. I is equal to our plasma concentration, okay? 2 main examples that you'll see on NCLEX are going to be your 0.9% normal saline and your lactated ringers, okay? When would I give isotonic? So somebody who has had blood loss, like hemorrhage, right? Or somebody who is in dehydration or hypovolemic shock. Also, when you have a person with severe burns is associated with fluid volume loss, so you want to replace that quickly with isotonic fluids. Now let's talk about hypotonic fluids. So hypotonic fluids are used to treat intracellular dehydration. So this is very dry and shriveled up cells. They're very thin. Now hypo goes into the cell, so O and O, okay? Now, what is an example that you'll see on NCLEX is 0.45% normal saline, okay? And when do we typically give this? When we have cells that are dehydrated, such as in DKA or in hyperglycemia. Just a quick content review, DKA is seen in type 1 diabetics, HHS is seen in type 2, which are both forms of severe hyperglycemia. Now let's talk about hypertonic fluid. So this is used to treat intracellular overload. So these are very swollen cells. So I use the E in hyper to remember that we want the fluid to exit the cell. So I have a very swollen cell and I want it to get out. So hyper, we exit the cell. Examples include D10W, D50W, D5 with normal saline, and D5 with lactated ringers. So when would I give hypertonic fluid? When I have a low serum sodium, but more specifically, and as seen on NCLEX, when a client has cerebral edema. So remember, hypertonic solution is going to be a very thin type of solution. It's going to pull the water out of the cell. So if I have cerebral edema, I want this solution to pull the water out of the cell to decrease my cerebral edema, okay? Also, another pharmacology hack, tip and trick for NCLEX, mannitol is a diuretic given for cerebral edema, okay? I hope you enjoyed this video. Follow and like for more, and make sure to share with your friends.